Hello there, welcome to Plus Talk on Plus Life, where we're all about turning positive into a plus. You may have heard of something called PrEP, but what is it? How does it work? Why should we be thinking about it? Joining me in the Plus Life studio is our resident doctor and medical expert, Dr. Anu. Good to see you, Doc.
Good to see you
And
too.
Gus is there keeping
I
you
know,
company.
he definitely
We
is
could
good
do a whole
company.
Plus Talk on the importance of animals and HIV and what they do.
Mental health.
Mental health. Well, that's for next time, because today we are talking about PrEP.
Yes.
So let's dive into it. What is the difference between PrEP and ARVs?
Yeah, let's define what both are first. So
Okay.
PrEP is pre-exposure prophylaxis, right? Protecting prior to even getting exposed to potentially HIV. And ARV is antiretrovirals.
That's what I'm on.
Yes. It's also called ART, antiretroviral therapy, right?
Okay.
So I just want to make that clear. Pre-exposure prophylaxis, you're just taking something, generally it's a two-drug regimen, or now with the injectables, it's just one drug that protects you against possibly getting HIV. And then ARV is the actual treatment if you do have HIV.
And just to be clear, when you say a two-drug regimen, but it's in one pill.
Correct.
There's two drugs in one pill. I don't want people
Exactly.
thinking you're taking two pills.
No, just one pill.
Okay. So is PrEP something that just gay guys should be taking?
Absolutely not. And I don't like the stigma, right? I'm glad
But
that
it's
you
so
asked me.
there. Like, that's what everyone thinks. PrEP is just for gay dudes who don't want to wear condoms.
It's anybody that potentially has a risk of being exposed to HIV.
So that is any human, no, it doesn't matter what your gender or gender identity is, anybody.
Anybody.
So
I have at least a couple of females in my own practice that are on PrEP
my girlfriend Sherry can be taking PrEP if she wants it.
if she wants to.
Yeah, okay. Well, that's very interesting to know, because I think so many people still think that this is just for gay men who don't want to use condoms when they have sex.
Yeah, and we're breaking that stigma.
Amen, Dr. Anu. Now, can I only get PrEP by going to a sexual health clinic?
No.
Because there's stigma around that.
Yeah, I prescribe PrEP, right? I'm just a regular primary care provider. So you can go to your doctor, and if they are comfortable with it, of course they will prescribe it. If not, you can look up HIV prevention services online and find a provider near you that can prescribe it as well.
There also seems to be, I'm seeing a lot of ads on my social media feeds for these companies that can get you PrEP, where you don't even necessarily need to speak to your regular doctor. It hooks you up with a doctor's appointment and things like that. So
Yeah.
that's another way.
there has to be a doctor that's
Right,
behind it.
but
yes.
it's like a concierge service.
Yeah.
Now, if I am a top, do I really need to be on PrEP?
It doesn't matter. If you're top, bottom, variable, you do need to be on PrEP
Why?
because there's still a risk. Yes, there's more of a risk if you're having receptive anal sex of contracting HIV, but there still is a risk, and you need to be responsible.
I want to detour just a little bit here and go back to something. We're talking that PrEP is for everybody. There are a lot of people out there who will say it's only men who can give men or women HIV. But a woman can potentially infect a male sexual partner with HIV, right?
Yes, because again, if let's just create a scenario.
Sure.
If that woman per se has open sores, right, in her vaginal canal, from, let's say she has another STI such as herpes or
Which is
Pancreatic or
very
whatnot,
possible
right?
if and you don't know because you're not getting tested.
and you have sex with her, then you would carry a risk of getting HIV.
So it's not just men who are infecting people. Women can infect as well with HIV. I just want to thank you, because I think there is some sort of myth out there that this is something that just men, and I know I've gone off topic on PrEP.
And again, we always say HIV and sex, but let's be honest, there's plenty of IV drug abuse out there too.
Yeah.
We need to make sure that we talk about that too.
Getting back on the PrEP topic, how often do I have to take PrEP?
It depends on the formulation of PrEP that you're on. It also depends on how you're using PrEP, right? So if you want to be protected 24/7 with the pill option, one pill that consists of two medications, then you take it on a daily basis, one pill every day. The injectable, it's once every 2 months. Again, this also varies because there's on-demand PrEP, there's also periodic PrEP, and that will change according to your needs.
Okay, so talk to your physician.
Exactly.
And sort of think about your lifestyle and how many sexual partners and how often you're having sex.
Yep.
To kind of break that one down. What is the difference? And you talked about, you've just mentioned the injectable there. What is the difference between the pill form of PrEP and the injectable form as far as what they do, or are they the same?
The efficacy or how effective it is essentially the same. And like I said, the pill is every day, the injectable is every 2 months.
But it does the same thing.
Pretty much.
So it's whether you want to take a pill every day or whether you want to go and see a doctor. Can you administer that shot by yourself, or do you have to go to a clinic?
You'd have to go to a clinic.
Okay, so there's that. Side effects. What are the side effects of PrEP?
The major side effect that I see, and let me just state this, is the side effects do get better as you're on it for weeks. Your body actually,
Gus would agree.
Yes. Thank you. This is mental health therapy for me.
You're welcome.
So the side effects get better as you're on it for weeks. But major side effect is nausea, vomiting, headaches, fatigue. I would say the two major side effects to kind of look out for, and this is why when you're on PrEP, it's important to visit your healthcare provider every 3 months, is to get your kidney function tested. And then with the injectable, there is a risk of just local skin irritation and swelling.
And we should point out that everybody is different.
Yes.
A lot of people don't have any side effects.
Yeah.
These are just the ones that, when they do arise, are the most common. But for a lot of people, there are no side effects. Yeah. I just want to make that. Now, if I'm on PrEP, do I still need to wear a condom?
Yes, because PrEP just protects against HIV. It does not protect against other STIs such as syphilis and gonorrhea and chlamydia. So, yes.
So condoms should still be a part of, if you want to use a condom, you should still be using it to protect yourself from other STIs. Now, what happens if I want to come off PrEP? Or do I have to stay on PrEP for life? Or, let's say I meet someone, I'm on PrEP, we begin a solid relationship, there's no other sexual partners. Can I come off it, or do I have to stay on it?
You can come off of it, right? But I mean, it's being responsible. If you don't have HIV, your partner doesn't have HIV, you're in a monogamous relationship, committed relationship, then you can come off of it.
What's your recommendation for somebody who is, where one partner is negative, one partner is positive? So, a potential partner for me, I'm HIV positive and undetectable. Should my sexual partner be on PrEP, or do we not need to worry about that, or is that a conversation between the parties?
I think it's a conversation between the parties, because it really depends on how responsible your partner is. Just because they are undetectable at that point, if they're not compliant with their medications and become detectable, that puts you at risk. So it's better off to be on PrEP then in those circumstances.
On whether you have an open relationship or it's just the two of you.
Yeah.
I think there's a lot of factors, but that's a conversation to have with your partner.
Mm-hmm.
But
and your healthcare provider.
And your healthcare provider. I'm undetectable and they're negative. PrEP is a choice. It's not necessarily a necessity to keep them safe from being possibly infected, because as long as I'm undetectable, there's zero risk.
Exactly.
Right. That was my very long way of trying to get to that point. Lastly, and we've touched on this, who should take PrEP?
Anybody that potentially can see an increased risk or puts themselves at risk for contracting HIV. Anybody.
As a physician,
Yes.
Is this something that you really recommend sexually active people? Like, this seems to me like a no-brainer. Like when the pill came out for women as a form of contraception, this to me seems like something that just makes sense.
Yeah. And I think that there are still some people that are nervous about having that conversation with their physician, correct? It's, to talk about
I'm
HIV.
not. Don't look at me like,
Yeah,
you are my physician.
Right, but there still are.
Yeah.
And I want people to know that they should have an open and honest conversation with their physician. There's no judgment, and we're here to actually protect and prevent illnesses.
And PrEP helps protect and prevent against HIV.
Absolutely.
Okay, we talk a lot about sex with PrEP, but what about IV drug users? Is this something that helps in that area too?
Same thing.
Same thing?
Right.
Really? So if I'm an IV drug user, PrEP is something I should be considering.
At the end of the day, it's just, it doesn't matter how you're contracting HIV. This is just to prevent HIV.
It seems so simple. Because it is, right?
Anybody that is at increased risk of contracting HIV should be on PrEP.
Dr. Anu, thank you very much for your time.
Thank you.
That is going to do it for this episode of Plus Talk. If you want more information, go to our very informative website, pluslifemedia.com, and you can follow us across social media. We're at Plus Life Media. Like, follow, share, tell your friends about us. Until next time, see ya.